1980, as war raged in South Sudan, the Ugandan government, with the help of development partners, set up Rhino Refugee Camp, which lies between Madi-Okolo and Terego districts in the West Nile region. The camp has become home and source of hope for many Sudanese, South Sudanese, Burundian and other refugees, currently holding 19,000, refugees with women and children making up the largest percentage. Within this camp lies Olujobo Health Center III, located in Rigbo sub-county, in Rhino Camp Town Council in Madi-Okolo district, where most refugees and members of the host community choose to go for medical care services. Due to the high number of patients needing medical attention, the limited ward spaces leave no option for health personnel but to share wards when administering treatment to different patients irrespective of their gender and age. At times, after birth mothers share the same ward without patients.
In terms of space for where our mothers used to come for antenatal services, family planning, postnatal, deliveries, the space was very squeezed, and the room was even shared at some proportion, could even admit some male to the other side of the ward.
To some extent, the health guidelines are overlooked to the extent of women delivering without privacy. Patients sometimes have to share beds and some are forced to rest on the cold floor due to the lack of adequate beds.
Space for them, but if they're not there, they will be taken to the...
Many of the equipment at the hospital appear to have been in use for some time and are now losing their integrity, with some starting to rust.
Where we had only the 2 beds
the shelter, acting as the waiting area, is on the verge of collapsing, and the tent, serving as the immunization center, is also in poor condition. The tricycle ambulance has been broken down for nearly 2 years, leaving expectant mothers with no option but to endure the pain of trekking longer distances or use risk borders. Thanks to supports from Johannita International Assistance through their donor partners of Transcultural Psychosocial Organization, TPO, under the Maternal and Mental Health Access, Psychological and Livelihood Support Project, a newly modernized labor ward has been constructed. This ensures that women, teenage and disabled mothers can have safe maternal and childbirth services, as well as mental health and psychological services.
It has been this facility of Olujobo Health Center III, which is the only health center 3 here, serving this population of about 3 to 4 parishes. So the contribution by Johannita to put for us the maternity ward has been significant.
By this project, the community, something very important was implanted already to the members of the community, like the beneficiaries that already exercised their benefits from the project. So we feel concerned as leaders now pronouncing our happiness because we are also benefiting out of it as a
meeting the needs and really working closely with District 2 on what the needs were, and I am working to meet those needs. And the meeting today has been really interesting in identifying where there are still some gaps.
The facility has been installed with 12 beds in the after-birth ward, maternity and labor wards with water access and immunization ward. Despite this improvement, the nurse-to-patient ratio at Olujobo Health Center III is still low, with only 5 nurses attending to over 200 patients per day and 450 mothers monthly, 70% of whom give birth at the facility, with at least 7 mothers receiving antenatal care on a daily.
You're only 2 midwives. There comes in a referral. You need 1 person has to take off with a referral to the next level of care and leaves this other person alone to handle all these other big population.
On the ground now there are only 13, the 6 are not there. Because if you come on the ground, the service is a bit difficult. I request the Madi-Okolo, they must employ more staffs.
Ideally, we are supposed to have, I think, like 8 midwives that are supposed to handle the maternity, all the service points that will provide comprehensive maternity services in this facility.
Under the project, 424 women have received assistance, including mental health treatment. Many pregnant women have shown increased interest in antenatal services.
With the training that we received from Joanita TPO, we were able to improve our knowledge and skills in offering the services to the mothers and their newborns.
We had approaches like cognitive behavioral therapy. That was a group-based approach, as well as the problem management plus, which is also another group-based approach in delivering mental health and psychosocial support services.
Ssenyonga, Mulinde, NTV Tonight.